Commissioners, and as we like to do, we're going to start with Pledge of Allegiance and a moment of silence.
Of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, our first item of business is the swearing in for Commissioner from District 5, Mrs. Susan Krebs. And
You want him to do it, Chris?
Thank
with
you,
the
Clerk of the
microphones,
Court.
Even with the microphones?
do we got to stand or bow or what? Okay, we're okay.
You're good.
Good question, though.
Raise your right hand and repeat after me. I state your name.
I, Susan Krebs,
Do swear
do swear
that I will support the Constitution of the United States
that I will support the Constitution of the United States
and that I will be faithful
and that I will be faithful
and bear true allegiance
and bear true allegiance
to the state of
to
Maryland
the state of Maryland
and support the Constitution
and support the Constitution
and laws thereof,
and laws thereof,
and that I will,
and that I will,
to the best of my skill and judgment,
to the best of my skill and judgment,
diligently and faithfully,
diligently and faithfully,
without partiality or prejudice,
without partiality or prejudice,
execute the office
execute the
of
office
Commissioner for Carroll County, Maryland,
of Commissioner for Carroll County, Maryland,
according to the Constitution
according to the Constitution
and laws of this state.
and laws of this state.
Congratulations.
Do you two mind standing right here? We'll stand up
Do you want
behind
her
you and do a
commission?
group photo.
In that photo,
Yes.
and I have to have her sign something.
To be official.
How I'd like to do this is do a picture, just the two of you.
It's like a marriage license, not official until it's signed.
Can we do a picture, just the two of you, then all of you together?
You want us down here?
Not yet, not
Okay.
yet, not yet.
Should we move out of the way, Chris?
Yeah, yeah, if you could. And get a picture of the two of you, then a picture of just Commissioner Krebs, then a picture of you with the board.
This
Does
isn't
that sound
going to
good?
take a while, is it?
All right.
Susan, Commissioner, take the paper clip off of it.
Oh,
Yeah, yeah,
my
that'll,
goodness.
that'll reflect.
Thank you.
Thank you.
Ladies have to keep me together.
We all work together. It's a team.
Thank you.
Okay, now hand that to me.
Or to,
I'll take that.
or to,
This is the one, this is the one we need to
This is
sign?
better than the one that's.
No, that's the
Okay.
test book. So
Okay.
sign that if you want her
Okay.
to sign. Want a picture of her signing it real quick?
Yeah, we'll do that. We'll
Okay.
do that. I will do that after.
Okay.
it's nice. That nice paper clip.
All right, now
Now,
the gang, the whole gang.
Okay.
welcome.
We're gonna little color to this organization.
A little bit.
You are a little.
Congratulations. That's great. It is on. It is.
The five of us or the clerk too?
I think the five of you first,
Okay.
please. Okay. Oh, that stinking exit sign. I'm gonna Photoshop that out.
Photoshop that out, yeah.
All right, thank you. Okay. Heather. All right, everybody here, please. Thank you. That's it. Now we do the
Good.
signature. Thank you.
So I have a box for the two of us. Do you want that?
Certainly.
That's a good idea.
Let me come to you. You mean my pickleball family or my real family?
Which you choose. That's up to you.
Which do you like better?
Your mom and
That's right.
Oh, yeah, 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 yeah.
picture, exactly the way.
You look gorgeous.
Oh, really?
That's the second day in a row you called me a font.
I know. Well, you're definitely a font. You're a font of something. I don't know about information.
Better than being called a fool.
Sorry.
Yeah, you'll find time. Okay.
Thank you. All righty. Right here. Right here, please. Thank you. Excellent. Thank you. Congratulations. Thank you so much.
Name from left to right. Yeah, Mark. Mark Krebs. Sue.
Mark.
You did great.
I'll give them one.
There you go.
Sorry.
Oh, that's good.
No.
Thank you.
I'll text it to you. I like you.
Pickleball friends. You know where they are, right?
You have it.
The picture of the pickleball.
You got that?
Or you have it embarrassed. Thank you.
You got it, guys.
Seeing you, Heather.
Hi.
Take care. See ya.
Yeah.
Hey,
Whoever's leaving.
Marcia, you two try to behave wherever you're headed.
Oh, you have no idea.
You crushing?
Now we play, he's.
So thank you, everyone, and everyone's welcome to stay. I don't know why a lot of people want to leave right after their order of business is done, but you're welcome to stay, and we're going to go into Priority Carol. We alternate directions when I can remember where we were last time, and I think, Commissioner Guerin, it's your turn.
I think so. Thank you, Commissioner Kyler, and good morning, Carroll County. Just a very brief thank you to the Department of Fire and EMS, all the attendees, Lieutenant Mike Karolenko, Chief Robinson, the Sheriff's Department, the CCV, so the volunteers. I'm going to leave somebody out, but I want to thank everybody for putting together the ceremony this morning, and to thank you to all the attendees. It was wonderfully done. It's so important that we continue to honor this day every single day and every time this year. So my special thanks just to everybody who was involved in putting that ceremony together this morning. It was extremely well done. And that's all for me.
I'm going to be brief this morning. First and foremost, want to welcome Commissioner Krebs. It's an honor to have you with us, and look forward to working with you. As Commissioner Guerin mentioned, we were at the 9/11 memorial event this morning. Tremendous event as always, and you know, life's a little weird these days, and I can't be any politer. Just so many things going on, whether it's tragic deaths of various people in this country, the 9/11 24th anniversary, and you know, it just makes me question, where are we headed? I know we don't all agree at times on a variety of topics and issues and ideas, but I'm just truly dumbfounded at what's going on in this country right now. You know, after 9/11, which shook this great nation to its core, we as people got together and realized that, you know, there were bigger things than us, and we had to have unity and respect for each other. And I would truly love to see us get back to that somehow, some way. I realize that takes all of us being open and willing to have those conversations. But to me, it's just, we are in such a very, very strange place right now. I wasn't really going to comment on this morning, but I don't know how I can't. And, you know, we all sit up here and we talk about a variety of things. This county does a lot of great things together, from our interactions with our wonderful nonprofits to so many other groups, and we all look out for each other, and we do a great job of that. But I think, you know, we've got to figure on a daily basis, how do we do this better together? And yes, we're all going to have different beliefs and different ideologies at times, but you know, that unity and that respect is so important, because we are supposed to be one united states of America. And it's just, to me, I'm just at a loss after watching some of the things I've seen unfold of late. That's all for me this morning. Thank you.
Thank you.
Well, thank you, Commissioner. A couple things myself this morning. So first of all, we begin by noting and marking that this is the 24th anniversary of the terrorist attacks of September 11th, 2001. And we remember and we reflect on the occasion, not only because of the horrific loss of human life that day, but because it forever reshaped not only the United States, but the world, and because the root issue, radical Islamism, remains a threat against our country and against the West. And the time may have changed, but the threat remains as dangerous as ever. And so we remember because to forget would be disastrous, not least of which to remind ourselves of the privilege and the blessings of what it means to be an American and how our values are worth upholding and striving to fulfill. And as such, I was very grateful to be present for the incredible ceremony hosted by the Department of Fire and Emergency Services this morning. And along with my colleagues, I want to thank everybody who put that together. May God always watch over us. Second, as Commissioner Gordon had alluded to, what happened to Charlie Kirk yesterday is horrific and inexcusable. It was murder. This trend of politically motivated violence has to end. In the United States, we settle debates and stark disagreements that we have with one another, and we have the absolute right to disagree and to offer other ideas. But we settle those things with persuasion, with votes, with compromise. Harassment, threats, violence, none of this has a place in civilized American society or in American politics. So I want to offer up my prayers for Charlie's soul, for his loved ones, and for anybody who's been affected by his passing. Third, I want to formally welcome Commissioner Susan Krebs to the Board of Carroll County Commissioners, to congratulate my friend once more on her selection, and to say that I'm very much looking forward to working alongside you in the time to come. I know that you bring a lot of experience and wisdom, and I'm certainly looking forward to working with you and knowing how well that you will do. Fourth, I want to commend Citizen Services, Commission on Aging and Disabilities, the Bureau on Aging, on the awesome Aging Your Way Expo that happened yesterday at the Ag Center. I very much enjoyed attending that, getting to see good friends, making new friends, and learning more myself about the services and opportunities that are offered for those who are of age and who are disabled. Each year the event gets bigger and better, and I'm looking forward to next year as well. And to end on a slightly more lighthearted note, as always, I had the pleasure of attending the monthly Farm Museum Advisory Board meeting. They're gearing up for their fall and holiday events, not least of which is Harvest Fest, which will be in October. The new pavilion over there is well under construction now, and to end on a very lighthearted note, October is also going to be marking the 10-year anniversary of the arrival of the oxen Jack and Jim to the Farm Museum. And so, Commissioners, that's all from me this morning.
Commissioner Krebs,
Thank you. We've had
go first next week.
I've got a 20-minute speech because we haven't had it for like 2 months because there's been a void in District 5, and there's a lot been going on. But I think it was said by everyone about the memories of today. My memory of 9/11, I was sitting on this Carroll County Board of Education, and we planned for lots of emergencies, but we've never planned for anything like what happened that day. And since then, we have spent a large amount of our time making sure our schools are safe, our children are safe. But on that day, no one knew what to do. Do you send the kids home because their parents might not come home? Some of these people work in D.C., they worked at the Pentagon. We were like on a shoestring trying to figure, what do we do with this type of emergency, which never was planned for? So a lot has been done since then with school safety and emergency preparedness, and many people have been talking about that since then for the last 24 years. But that's my memory of it. I was actually on the treadmill at Merritt. I actually used to go to the gym. And I remember we all just could not stop watching what happened. I ran home, the telephones were jammed, and calling the Board of Education, what are we doing? Went over to the school where parents were trying to pick their kids up. But since then, it was something no one ever anticipated. But since then, we have to consider those types of measures. But The one thing that I think we hope, and I'm as upset today about Charlie Kirk and about just listening to the memories of 9/11 on the way up about the first calls that came into the air traffic controllers. It's just, we need to not forget. But I think we need to focus on where we've come as a nation and our community, and I say this, and I don't just say it because I live here. You know, we're the best. There's so much good stuff that goes on here, and we need to focus on it. So last week, on Friday, the Shooting Stars, which you've probably never heard of, but the Shooting Stars are an all-inclusive sports program based at Freedom Park in Sykesville, serving children and young adults with special needs. And for over 5 years, the program has welcomed more than 80 entries and athletes in each season, supported by 200 youth from our schools. They come out, the teams, the soccer players, the lacrosse players, and volunteers helping these folks that don't get a chance to play on a regular team. And it's really cool to see. They have so much fun. Shooting Stars blends soccer with free play and is proudly supported by local and regional and recreational travel soccer, and now lacrosse. And seasonal celebrations and trophies and special guests highlight the joy. We had the Sykesville Police come down and actually give them all out stickers, and they love stickers. And then the Freedom District Lions Club gave them all snowballs. Of course, they all wanted their own flavor. And it is just a joy to see all of these folks coming together for 4 Fridays in September to help these youth that don't always have an easy place to go. So that's one of many, many things that are going great in Carroll County. The second thing we did on Saturday is we went to the Break the Stigma Recovery is Cool Festival. As you know, in Carroll County, we embrace problems and find solutions for them, and one is the opioid epidemic and drug epidemic for years that has come and gone. And it's not just driven by the government, it's driven by all of the nonprofits and all the people that really care about it. So it started off with the recovery walk, I believe, that was Tim Weber. And it was put on by the Carroll County Health Department, our Bureau of Prevention, Wellness, and Recovery, partnering with lots of nonprofits. I think we had 6 or 7 Lions Clubs there with tables, and then wellness and recovery groups about breaking the stigma, and recovery is cool. And this is a National Recovery Month, it's September, the month. So they kicked it off in the morning with Tim Weber having a Nope to Dope walk at noon. I don't know if anyone participated in that. And then at 1 o'clock, everybody went to Westminster Park, and they had a medication take-back program there. And there were excellent speakers, and all of them were reflecting on their recovery path. And once you hear from these folks who have come from some very tough places, some have been arrested many times, have a record, but now they're productive citizens, and they're sharing their stories. And it was really interesting for us to make sure we understand what this path is. So it's an opportunity for people to connect with this particular community. It's an empowering day for some folks that are celebrating recovery and for some that are looking for recovery. And I just thank everyone who had anything to do with that. Everything was perfect until 3 o'clock. It was over at 4, and all of a sudden this black cloud was in the pictures, and it's like, uh-oh, and the wind started blowing, the rain started coming, and everybody cleaned up, and we're out of there. We would have cut it a little short, but other than that, it was perfect. So anyone that's involved with that, we thank.
Thank you. A couple personal notes. I mentioned Emmanuel's yard sale that they had last Saturday, very successful, a lot of people there. And like Commissioner Krebs just said, the weather stayed nice for most of the day, so that worked. And for our attorney, I'd like to mention, yesterday I renewed my my son's 20-game Orioles tickets, so I'm an optimist. You need to be too, okay? They're gonna win. A bunch of farm companies have had their company parties, and Rhonda and I are lucky enough to get to go to a lot of them, and I love Carroll County, I love the farm community, and it's amazing the number of people you see there and the many, many, many things they do. We also had family in this week from California and Minneapolis, and that was awesome.
Whoa, Freudian slips there.
Yeah, it's hopefully they're not listening. We had a transit advisory committee meeting, and they are are looking at different routes, and some, they almost need to add some are really diminishing in ridership, and we really need to work on it. It's so important, I think, particularly for the senior citizens, to get to the senior centers, to get to doctor's appointments. I don't feel as near and dear to some of the people that use it to get to work, but I'm glad they do it because it keeps our transit more busy. But I think we have a lot of needs. Citizen Services talked about it before. They rely on it. We really need to keep it going, and they met out at their center and did some education on how their vehicles work and what they do. We had cabinet meeting, and I always love hearing from all the directors. Aging Your Way, some of the guys have mentioned that. The one thing I want to add to it, we did have 2 representatives for a congressman and a senator that came and were very active there. So Carroll County gets attention once in a while. The 9/11 ceremony this morning was awesome, and I think the big lesson there is what we learned 9/12 and forward, how we reacted. And it's the same thing. Some guys have mentioned assassination yesterday. Riding back from the training center, I had news on, and the guy was pretty slick, but not good enough. They have films of him getting on the roof, getting off the roof, leaving the property. He had a mask, so they don't see his face, but they see his body language. So our country's great. We're going to catch him. Schools, Commissioner Krebs met, and it's fall. The schools are starting. A lot of extracurricular sports, drama, band, and please support them. And then I'd like to always try to mention, support our fire companies. We had a lot of professional and some volunteers out there this morning, but the volunteers still desperately need your support. We're doing a great job with EMS, but we're not covering everything that the volunteers furnish for us, so we need to help them. And that's it for me, and now we're going to talk about Carroll County Youth Service Bureau. Thank you.
Good morning to you both.
Morning.
Morning.
Hard to follow today, definitely an emotional day. But thank you for having us, and good morning. Welcome, Commissioner Krebs, and you're representing my district, so really excited to see you here. Thank you for providing me the opportunity to introduce myself to you today. My name is Lisa Guroff, and I, as of the end of June, am the new Executive Director at the Carroll County Youth Service Bureau. You all know my predecessor, Lynn Davis, very well, and although I cannot promise to fill her shoes, I do hope to build on her remarkable legacy and expand the scope and the impact that Youth Services Bureau has here in the county. With me today, I have my board chair, Pat Shepard, our clinical director, Angela Schmart, and our director of development, Andy Lucchini. Before touching on my plans for CCYSB, I wanted to just share a little bit about myself with you. I'm a proud resident of Sykesville and Carroll County. I'm a licensed clinical marriage and family therapist, and I've been in the field for over 30 years and really have experience across the whole behavioral health continuum. I have worked both at the state and national levels, and I'm really excited to bring everything I've learned back to the county that I love so much. As a longtime resident, I've actually raised my 4 boys here. Carroll County, I really believe, is an ideal place to raise our families. We have excellent schools and a small town feel. We have wonderful neighbors, really family-friendly places and events and opportunities. I'm proud to say that 2 of my sons have served in the military. My 3rd son is a civil engineer, and my youngest is a sophomore at Salisbury, and all 4 of them are very proud Carroll County Century graduates. CCYSB has served Carroll County since 1972, as you all know. And during that time, the organization has really built a strong relationship with our local government and our businesses, our educational institutes, our nonprofits, our families, and our individuals. We use evidence-based practices to serve all of our Carroll County residents, from young children to seniors, and really regardless of their ability to pay. We also provide jobs for Carroll County residents. Of our currently 67 full-time employees, actually 76% of them are Carroll County residents. And while our community-based programs reach across the county, our work really has been very Westminster-centric. And over the next couple of years, with our talented staff, our goal is to really reach more citizens, from Union Bridge to Manchester to Sykesville and Taneytown. We also plan to increase the number of our on-site appointments and our therapeutic group offerings. In all the early stages, so I am only in week 11, we have really been looking at and having a lot of conversations within our community and with a lot of our partners. And I wanted to just give you a sense of my vision for the Youth Service Bureau and our role in the county. I really am not exaggerating when I say that this job is actually my dream job. I've been watching the work in the Youth Service Bureau for years. I'm really excited to be in the county working. And I'm honored to have this opportunity to really give back to the county that has given me and my children so much. I look forward to continuing the positive relationship that we have had with the commissioners for over 50 years. And I personally want to invite each of you to come see what we're doing, to meet our staff, to get to know our programs, and to learn about our plans for the future. In fact, we'll be hosting our next breakfast at the Bureau on September 26th at 8:30, and would love to have all of you join us. We also have a packet for everybody. At the end of this, I'm sure all of you know Andy, and there is a picture that she's asking me to make sure I get. We do have, from the Be Kind signs, we actually have an I Love CCYSB sign. So if you'll indulge us, I would really appreciate that. But happy to answer any questions that I can as I start this position.
Commissioner Zenning.
Well, welcome.
Thank
I'm
you.
sorry, please, Commissioner.
That's okay. Welcome. And you have big shoes to fill, and I know
Yes,
Lynn missed it so much that she came back.
she did.
And so now you're her replacement. So she's been there a long time and did a wonderful job, and I'm sure she's glad to hand it off. But I was just wondering, do you know about the Boys and Girls Club and some of the youth service organizations we have in our schools?
I do. We've already met with some of them, not with the Boys and Girls Club, so it's only week 11. And my goal was to kind of really embrace and get to know everything that we do first. And then I've met with a lot of our county partners, and the next is our whole list of community partners that I plan to go out and visit personally.
Well, one of the things that our opioid prevention task force has been focused on for years, I've been on that for like 12 years, is about middle school prevention. I mean, we on the back end, we have recovery, but we're trying to focus on the prevention, and we thought that middle school was most important. And Boys and Girls Club was started off in Westminster, but now they've expanded to the whole county. And they just opened in middle school at Oklahoma Road this year and Sykesville last year. And then they now they got a large grant for up at, what's it called? Pantherplex. And 3 of the schools are now meeting there, and they're actually having like Friday night things to do. So it's a phenomenal organization. So if you can get some of the people hooked up, sometimes it makes them feel connected with the Boys and Girls Club. And then we also have Leo clubs in a number of our high schools. And we're trying to, and they're related to the Lions, but they're service-oriented, and we're trying to move that down to the middle schools as well. So kids can start thinking outside of themselves. And so I'm sure you're aware of some of these things, but just Sean Davis with the Boys and Girls Club, there's lots of opportunities there if folks that you have might be able to take advantage of that.
Absolutely. Yeah, I was aware of the program through the LMB of the Boys and Girls Club that they were doing, yeah.
Good.
Thank you.
I was going to say welcome, and if there's anything that we can do to help facilitate things, let us know.
Thank you.
Thank you. Welcome. Congratulations.
Thank you.
I was going to say welcome, but I met you the other week at the Crab Cakes for a Cause event that Youth Service Bureau had, but I can at least say welcome to you formally this morning.
Thank you.
Look forward to coming over and getting to spend some time over at Youth Service Bureau. You all do such a tremendous honor to the community when it comes to mental health, which we all know is just so tremendously important, and look forward to assisting any way we can.
Thank you very much.
You're welcome.
Andy has packets and the sign, if you wouldn't mind.
Do we want to do a
Did you
picture?
say you wanted a picture?
Yes.
If you would like.
Sure,
yeah,
we can.
Absolutely.
And while you're doing that, I've done a tour there before you, and I'd like to do it again. And you've got a lot of expansion in the future.
We
You've
do.
got a lot of stuff going on.
We do. If you drive past, I've got flags out so that we can start to visualize the project.
Yes, yes. And
Oh, that's nice.
Yeah.
is it more than three of you? Whoever you've got, come on up, and we'll do a photo. We can stand up here if we have to. If you have too many, or we can.
We
come
just have
down.
3, yeah. We have 3 because I think.
Okay.
Andy's- oh,
Okay, well, we can get you. You sure?
You standing here, going down.
Go down.
I understand.
Thank you.
You're not going to be in the picture?
No.
I tried to encourage her.
No.
That was quick. You
Yeah.
didn't have to think about it.
No. Too many.
Thank you.
Thank you all.
so much. Appreciate your time.
Oh, that's great. No, it's okay. I am corporate. We do have bodies, right?
I know.
Just phones and emails.
Exactly. I know. It's great to find this.
Yes. See you soon.
Yes. I hope so.
Now, HR is going to talk about group medical prescription drug and stop-loss benefits for our employees and how we're improving employee benefits. I'm
Good
always
morning,
excited
everybody.
when HR's here.
Morning all, and
You know.
congratulations.
Welcome.
Christy, you're looking quite autumn today.
Thank you.
Commissioner Krebs, I switched my watch band to match, so.
Oh, I did.
Yeah.
All right, you ready? Yeah. The Office of Procurement and Cooperation of the Department of Human Resources requests your approval to award a contract for the above project. An evaluation committee was formed to conduct technical and financial reviews of the proposals submitted. The committee evaluated all proposals based on criteria detailed in the proposals. Once this was completed, the committee members came to a consensus and recommended the best value proposal for the work required. After evaluating all the proposals, the evaluation committee recommended the award to CareFirst Blue Cross Blue Shield for group medical prescription drug and stop-loss benefits for employees and non-Medicare retirees of Carroll County government. The county reserves the right to renew the contract pending fiscal availability and vendor satisfaction. This amount is approved in the FY26 budget.
All right, good morning.
Morning.
I have a presentation for you this morning. With me, I have Robin Hooper, our Division Manager for Employee Wellbeing, and also Adrian Kepler and Paul Hugh from Bolton. And they were very instrumental in review of these plans and were a great asset to us with looking through these. So the first agenda item is for group medical, prescription drug, and stop-loss benefits. And these are for our active employees and non-Medicare retirees, so pre-65 retirees. Just as an overview of our plans, our health insurance plans for active employees and pre-65 age retirees are self-insured. So that means the county pays the cost of the actual claim minus any discounts provided by using a network provider, plus an administrative fee to a third-party administrator for access to their network as well as to process the claims. We also purchase what we refer to as stop-loss coverage, and that is for any claims that exceed $450,000 in a calendar year. That coverage will reimburse the county for expenses over the $450,000. The goals of the RFP were to evaluate vendors on pricing, plan design, network strength, pharmacy management, and customer service, to confirm compliance with regulatory requirements, to maximize the value of the benefits the county is purchasing, to safeguard against our catastrophic claims, and to align our benefits with organizational goals for retention, wellness, and competitiveness. The last bid was done in 2021. We have been with United Healthcare since 2010. Our recommendations for the group medical prescription drug and stop-loss benefits for employees and non-Medicare retirees is to transition the county's self-insured plans from United Healthcare to CareFirst Blue Cross Blue Shield effective January 1st, 2026. The coverage will include prescription coverage through CVS Health Pharmacy. We anticipate savings due to improved provider/prescription discounts, the network access to be improved, and rebates. There's no plan designs changes proposed. The network would be Blue Choice Advantage, and this is very important for employees and retirees who are looking to see if their doctors will still participate within the network. They want to make sure that when viewing CareFirst website, they are asking particularly if the provider, or noting particularly if the provider is in the Blue Choice Advantage plan.
This was probably my biggest question of this because of all the employees. So, and you evaluated that you think a lot of things are in network that were in network.
Yep.
What do I do if my doctor's not? Can I appeal to CareFirst? Can I appeal to my doctor? What do I do if all of a sudden I'm not in network?
Right. So we did, this was one of the big items that we looked at. 98% of our current providers being used are going to remain in network. There are also some that, since we started this plan, have unfortunately come out of network for United Healthcare, which will now be back in network with CareFirst. If your physician does not participate with the CareFirst network, we're happy to take that information and pass it along to CareFirst. I believe they have a team that will reach out and try to recruit providers. Depending on which plan you're in, the PPO plan, which is currently our Choice Plus plan, does have out-of-network benefits associated with it. There's a higher cost to the employee, but you can remain visiting that provider. It would just be more out-of-pocket for the employee.
Thank you.
You're welcome.
And I just have a question.
Sure.
On the network adequacy, you answered the question, 98% of the providers. Do you know, United, what they were offering, what percentage of the providers did they offer for us if we remained with them?
UHC? They had just said, they looked at their overall provider network and then looked at the providers that we have been using through them. So obviously the percentage was just as large as what's covered in, because they're currently in network for our employees.
I just know that United has had a difficult time lately with the network adequacy.
Yep.
And it's going to be interesting to see what happens October when the new plans come out, because I think more are going to drop out. And CareFirst really does have the best network in Maryland, and a lot of it's because of our Maryland model. But I think there's going to be a lot of turmoil between now and October until this whole Maryland, when the new numbers come out, and even next year with the new waiver going through. So I think it's a very good move, just from what I know about. I served on the healthcare committee for 16 years, and CareFirst has the best network adequacy of anybody in Maryland. So I think it's a good move.
Yeah, and just so everyone's aware, we started this process back in February, March, and that was prior to, we had a little bit of network disruption or potential disruption earlier on in the year, but this process wasn't done because we had network issues. It was done for the variety of reasons that I listed. It just so happens that things have happened since then, and I think you're correct, Commissioner. We will continue to see some of that disruption and some concerns, and it's unfortunate because it has affected our employees, most recently with Capital Women's Care and also the Johns Hopkins. So that has affected quite a bit of our employees. So
I think some of the providers have stopped taking Aetna altogether just because of the reimbursement rate. So
Yeah.
I think we're ahead of the curve on this.
Great, thank you. Yep.
And Christy, I'm sorry, one, kind of segueing from what Commissioner Krebs had asked and also what Commissioner Kyler had asked, there's obviously, if this passes, there's going to be a transition period. and what resources are in place to help people navigate that change?
Sure. So we will present some information at the end of the presentation regarding our open enrollment period. That is where our staff will be available, as well as Care First staff, to help with the transition. Our consultant Bolton will also be part of that. And then we're gonna, set up a website for people to be able to access information. We'll share all types of materials. I'm sure Care First will share materials as well, but that is our focus for the next 3 months, is to create a smooth transition and to make this as little of a struggle for employees as we can. We want to make sure that, and hopefully it will be with the number of providers in the network, and it's going to take some time getting used to a new prescription provider and all that other stuff, but our goal is definitely to over-communicate.
Thank you very much for that.
Yep,
Thank you.
sure. All right, so just a few additional items with the Care First plan. Ongoing care management program, similar to the ones we have right now. The administrative fee will be $45.16 per prescriber per month, and that includes a 3-year rate guarantee with a 3% rate cap on years 4 and 5. That is to pay Care First to process our claims, for us to use their network and the services that they provide. We also are proposing to remain at the $450,000 individual stop-loss rate. There was a significant increase on the stop-loss. That's always something that is going up. Care First proposed $60.82 with a 50% rate cap for year 2. So there is a lock in there, a little bit of security for next year. And then the last item is we always are very excited to use dollars provided by the healthcare provider for our wellness activities. Not only helps us, but it helps them with the claims that we see come through. And they had offered annual credits of $330,000 for year 1, and then $365,000 for years 2 through 5. And we'll be using that for technology, wellness, annual prescription market checks, these communications that we're going to be using. That is the intent of those dollars, and we will use them wisely to make sure that we are able to provide to our employees and pre-65 retirees. As I had mentioned, we're not recommending any medical or prescription copay changes. You may recall we made changes at the end of last year for January 1st of 2025. So you'll see our copay recommendations listed there. You will notice the choice and the choice plan titles were associated with United Healthcare. So we're going to filter that out, and we'll be moving forward with an EPO and a PPO program. The PPO program has the in and out of network coverage. The EPO has the in-network coverage. We're also proposing no changes to the plan design for the dental insurance. We will remain with Delta Dental, and we'll go through where we're at with our contracts, those other contracts, in a few slides. Also, no recommended changes for the vision insurance. And then the last slide is just, like I said, where we're at with our contracts. Our Delta Dental contract expires at the end of 2026, as in addition to our life insurance and long-term disability policies. So we'll get right back into this in 2026 and start looking at those insurances. And we are in a 3-year rate guarantee with Vision Service Plan, VSP, and also in a rate guarantee with Flexible Spending Account. As far as our EAP provider, we'll be back in 2 weeks or so with that on your agenda, because we did also go out to see what the market had in that case as well. That is all for this particular agenda item.
And I know you went through a lot of evaluations, and I think you made an excellent choice. But was there a close second, or not really? How did the evaluation go?
Yeah, I mean, it all really filtered down to the financials, and what we were looking at as far as the stop-loss costs and the potential savings on the networks, the use of the networks and what was available to employees. We've had United Healthcare for 14 years, so we were very familiar with them. So there was, a lot of decision that had to be made as far as what the cost benefit would have been to a switch. And at this point, we believe that there is more of a benefit to making the switch.
And I think rightfully so, understandably so, a lot of employees were tired of the emails of at the 11th hour saying, you might not be covered, please talk to people, and their negotiations were horrible.
Was not at the table, so I will just smile.
Thank you.
You're welcome.
I'll make a motion to approve the contract award of group medical prescription drug and stop-loss benefits for employees and non-Medicare retirees of Carroll County government to Care First Blue Cross Blue Shield.
Second.
I have a motion and a second. Any further discussion or questions? All those in favor?
Aye.
Opposed? Thank you. Okay, now the next step. Medical retirees. And what's the difference, or you're going to tell us?
I'm going to tell you.
Yeah, okay. I'll be patient.
The Office of Procurement, in cooperation with the Department of Human Resources, requests your approval to award a contract for the above project. An evaluation committee was formed to conduct technical and financial reviews of the proposals submitted. The committee evaluated all proposals based on criteria detailed in the proposal. Once this was completed, the committee members came to a consensus and recommended the best value proposal for the work required. After evaluating all the proposals, the evaluation committee recommended the award to Care First Blue Cross Blue Shield for Group Medicare Advantage with prescription drug for Medicare retirees of Carroll County government. The county reserves the right to renew the contract pending fiscal availability and vendor satisfaction. This amount is approved in the FY26 budget.
Right, so the Group Medicare Advantage program with prescription benefits is a fully insured program. This is for our retirees who are over the age of 65 and eligible for Medicare. Fully insured means that we pay a premium each month as opposed to paying the claims like we do on our self-insured coverage. So eligibility for retiree health benefits, retirees and spouses whose age plus years of service equal at least 75, with 10 years of service hired before April 30th of 2005, and 15 years of service if hired after that date, are eligible for retiree health insurance from Carroll County government. Non-spouse dependent coverage is not available to retirees, so it is only for retirees and their spouses. This plan is currently also with United Healthcare. We moved to a Medicare Advantage plan in 2022, I believe. Prior to that, they were part of the the self-insured plan. So this is a new, fairly new program for the county. Moving to a fully insured plan allowed us to estimate the costs a lot better. It does help with our accounting and with our OPEB calculations to allow us to know exactly what the cost is going to be by paying a certain premium every month for the retirees. So we went out to RFP for this as well. We want to always make sure that we're providing retirees with comprehensive, high-quality benefits, but also managing the long-term costs for the county. We compared vendors to assess the plan designs, the premiums, pharmacy benefits, the networks that they use, and the retiree support services. And we wanted to secure a solution that balanced affordability, quality of care, and sustainability while maintaining compliance with Medicare requirements, which Medicare requirements continue to become more and more complex all the time, trying to figure out what's covered, what's not covered, the rules and regulations associated with that plan. Lastly, we want to make sure that we support the health and well-being of our retirees. So our recommendations for the Group Medicare Advantage plan is also to transition the county's MAPD plans from United Healthcare to Care First Advantage PPO effective January 1st, 2026. Coverage will include prescription coverage through CVS Health Pharmacy, and we are also adding on what a plan or a service from Retiree First. They are actually Medicare experts. There are a lot of counties in Maryland using this service to educate their retirees, to help with claim issues, just to make sure it's a smoother transition for retirees into a Medicare plan, answer questions they might have. We are not Medicare experts in my office, so this definitely will help the retirees get the answers they need. With the Care First program, there are some minor adjustments in plan design. You'll see there the ones that are listed. So inpatient mental health stays, our current plan allows no lifetime maximum. This plan would reduce that to 190 days lifetime maximum, and that is the same as the Medicare limits. Hearing aid copay, there would be a slight difference in what the plan covers. Actually, it's more of a copay under the Care First plan than and the allowance is a little bit higher under the Care First plan, so that should be a slight benefit for our employees or our retirees. Orthotic shoe inserts, there's no coverage except for those provided for individuals who have diabetes and severe diabetes-related foot diseases. Again, the same as Medicare covers. There's no coverage provided for private duty nursing. The prior plan under United Healthcare provided an allowance of $5,000. I don't believe that's a very big benefit for private duty nursing. It's probably used up very quickly, but there's no benefit under this particular coverage. Eye exam reimbursement, and then is actually a positive for the plan, and generic drugs at retail and mail order. We can now provide retirees with a 100-day supply as opposed to a 90-day supply. So not a big difference, but a few more of the prescription. There's a 2-year rate guarantee on the group Medicare Advantage plan. So this is the recommendation. There's actually no disruption on the top 100 providers that are used for our retirees. You can imagine they're all over the country, so the Care First network is also all over the country, so this does help that they won't see as much disruption as well. And as far as the premiums for the group Medicare Advantage, the Medicare retiree does have to enroll in Part A and Part B Medicare, and their contribution to the county for their insurance varies based on length of service and date of retirement. However, you'll see the monthly premium had been locked in for 3 years for this coverage, 22, 23, 24. In 2025, we saw a $50 increase, and this year it would be a slight $5 and some change increase on the plan to move to Care First. Again, there was a significant increase proposed by the prior carrier. This one was probably one of the larger ones that we saw. So we believe that this is the best move for our Medicare retirees as well.
So Chrissy, if I may, same question with the previous item. If I am a retiree and the plan passes in a couple minutes here, how do I know what to do?
Yep.
Who's communicating with me? How am I getting the information? Especially because I'm not part of the active workforce now.
Yep. So this is really where Retiree First is going to help us as well with the communications. They will come in and do group meetings if we wish for them to do that, which we hope to have a couple of those for our retirees. They're going to come in and help us with that communication, make sure that they are, there's certain documents that have to be sent out to Medicare retirees, make sure we're handling all that paperwork appropriately and getting the retirees all the information they need. We are also moving more towards finding better ways to communicate with our retirees. As you can imagine, a lot of it was done by paper, phone, paper letter, those types of things. We want to try to gauge our audience and see if they're, open to more electronic communications and receive, get that information in our system. So we're very, very excited about Retiree First coming in, and I've heard great things about them from other counties and how helpful they've been with communicating with the retirees.
Thank you very much for that.
Welcome.
Well, now, this is no longer self-insured.
Correct.
So I know it varied, but Will this save the county money or just make it easier to predict and more consistent, or maybe both?
So that, when we switched to this type of fully insured plan, that happened back in 2022, and that did make it easier to predict. We were paying for that particular year. We knew what the premium was going to be. We knew how much it was going to cost us for that particular year. Where the increases came in and the large increase we saw this year, that's always a crapshoot, for lack of a better word, at the end of the year. So we tried to negotiate them. So the rate that we got from Care First was very, very competitive and very.
States, it says, same as Medicare. Is it concurrent, or does it fill the gap of like an 80%, 20%?
I'm going to ask my backup if they know the answer to that question.
You know what I'm saying? If it's concurrent, who takes first? Is Medicare's first?
Right.
So what does the county, how does that help the county employee? Is it, do they take up the extra 20% copay or co-insurance? If you're doing it the same as Medicare for the nursing home or for the mental health stay, what does Medicare's first, what is the secondary piece of that that would be covered? What's the advantage to the employee?
I'm sorry, you're referring to retirees, right?
Yes, for the retirees, yes, all for the retirees.
Okay, yeah. Oh, it's a
Oh, I'm sorry, could we ask you to come up to the microphone because easier here? Nope, that's all right, thank you.
Yeah, so since it is a Medicare Advantage plan, it should be Medicare Part A, B, and prescription drug. So there is no Medicare traditional plan involved. It'll be everything rolled up in just this Medicare Advantage plan.
So let's say they take care of the 190-day lifetime stay. Do they only pay a certain percentage? Is that where we would fill in the gap of that extra percentage? How does this benefit or help support the employee?
That is the
When it's
benefit.
concurrent.
That is the benefit.
That is it's the same thing.
Know from personal experience, my mom, my 96-year-old mother has Care First Medicare Advantage.
Right.
And it's Care for, it is that. Medicare, you never know, if there's an agreement between Medicare and Care First, that is not seen by the insured. So whatever their deal is.
On the Advantage plan, okay.
Yeah, what you know is that Care First pays. So this is.
So then they work it out with Medicare.
And then Care First works it out with Medicare.
It's not a traditional secondary plan
Right.
where Medicare pays first and then Care First would pay.
Right.
It's the plan.
I was just trying to figure out how this change is different from.
Under a general Medicare plan if they had a primary as Medicare and a secondary as another insurer.
Gotcha. Thank you.
Thanks.
Good question.
Advantage plans are a little weird that way. It's a bit mind changing.
Any other questions? Medicare plan?
I'll make a motion to approve the contract award of Group Medicare Advantage with prescription drug MAPD for Medicare retirees of Carroll County government to Care First Blue Cross.
Year 2026 health insurance, plan designs and contribution rates.
All right. Sorry to disappoint you. This is my last one.
I was going to say this is a marathon, but I guess not at this point.
The marathon's almost over. All right, so we are here to establish our 2026 contributions. The first slide that you'll see here is our average number of plan participants versus what we call the premium equivalent increases. So because it is a self-insured plan, we're not paying that $500 a month for coverage, but we do assign a premium equivalent rate to the plan so that we are able to figure out what our employees will contribute towards it. As you can see, we've had a pretty significant increase in our number of participants in the plan every year. That is primarily due to our addition of fire and EMS. So from 2023 to 2025, we've had approximately 150 individuals join the plan.
That leads to a question and a clarification. When you're talking about county employees, either what's easier to answer, who's not in it or who's in it?
Everyone is in it. So it includes
Sheriff,
the governmental
the
partners.
library.
Yes, the library and the Humane Society.
State's attorney?
Yes.
Can't
tell the difference. They are in the choice plan rather than the choice plus plan. The choice plan is in-network benefits only. The choice plus plan is the out-of-network and in-network benefits. Because we are very lucky to have a lot of providers in our area, our employees are able to get the services that they need in-network. So I believe that's why a lot of our employees are in the choice plan, where they only have the in-network benefits. The premium equivalent, again, that's that number that we figure out what employee contributions are based on, and you'll see that's been all over the board. So it's been up, it's been down, it's been as low as no increase in the premium equivalent to as high as 11% since 2019. If we move to the next slide, you'll see we're making a recommendation that there's no change to employee contributions for healthcare. We did increase those last year. However, with our change to Care First and our anticipation that we'll be able to hold the line, hopefully on our expenses, with the addition of our new network, with the addition of the reduced administrative costs, we are recommending no increase to the employee contributions. They would stay at 8% for our choice plan, and they would stay at 12% for our, what we're now calling the PPO plan. So the EPO plan was formerly the choice plan, and the PPO plan is now, it was formerly the Choice Plus plan.
And I think you all are saying, with 98% still in the plan, I know it's individual's decision, but you're not encouraging people to go outside the plans they had. They shouldn't have to change their philosophy on a plan.
Yeah, we're hopeful that in-network services are available for any of the needs of our employees or the pre-65 retirees or the Medicare Advantage retirees. But yeah, we believe in this area, or at least within a radius around the area, we are able to get employees and their dependents the services that they need. We move on to the dental plan. We're also recommending a stay on the employee contributions for 2026. You'll see them listed there, and we're recommending that with the Delta Dental Plan for the final year of our contract with them, 2026, that we keep consistent with our coverage levels there, as well as the employee contributions. Employees contribute approximately 40% of the basic plan, and they do fund the entire cost of the enhanced plan if they choose to take that for their dental coverage. Vision plan, also no change to the contribution. Recommendation is for the percentage of the monthly premium equivalent paid by the employee to remain at 20%. Lastly, for our pre-65 retirees, for the medical and prescription coverage that they receive through the self-funded plan, there's no recommended change to retiree contributions. For dental and vision, it was offered to pre-65 retirees with the understanding that the premium would fully be funded by them. It's not a benefit that they would normally receive. We did offer that to them in 2022 because the individuals on the Medicare Advantage plan were receiving vision and dental coverage, and we wanted to make sure that there was an option there for our pre-65 retirees. Unfortunately, there's been a pretty significant cost increase on both of these when looking at those individuals' claims on the self-insured dental and vision. So there is a significant increase. The monthly cost would be $37 for retiree only, and $80 per month for retiree and spouse dental. And that's only the basic dental. We do not offer them the enhanced dental. And then 29% cost on the vision plan. Lastly, just to speak a little bit to your questions, Commissioner Vigliotti. We do have open enrollment coming up. That's October 10th through November 7th. So lots of emails, lots of communication, lots of meetings, lots of us visiting different locations, speaking with employees out in the field. And then the last item that we'll mention is our Health is a Highway Employee Wellness Expo. That's Wednesday, October 15th, and Robin has a special gift for you in regards to our Health is a Highway Expo. So come on out and get ready to rev your engines, and it's about the journey, not the mile marker. Not the destination, I'm sorry. It's about the journey, not the destination. And every Every choice is a mile marker. Sorry, I haven't gotten my lingo down yet.
have a bag from Double Dental that
Thank
has
you.
a toothbrush,
Thank you.
mouthwash, dental floss. Each employee that attends the wellness center will also do that.
Thank you.
Thank you.
Cool.
I have a question.
Yes.
I haven't seen a pay stub, so I'm not, you all know the answer to this. Do we put the employer contribution of these benefits on the pay stub?
Yes.
Good. I just think it's nice because it's very significant, benefits, people don't realize how good we have it in the government with benefits, and I think it's good to show their cost has gone up and how much we're paying.
Yep.
Because you don't get that in the private sector, and it's a huge benefit, and it's good to know what
Exactly.
it is.
Yeah, thank you for
Makes you
pointing it out.
appreciate it.
Yes.
I'll make a motion to approve the plan designs and employee contribution rates for medical, prescription, vision, dental, and Medicare Advantage as recommended by Human Resources.
Second?
I have a motion and a second. Last question, I promise. So the new cards for the employees should be no different than last year. They'll be timely and what seems to happen, you go to a doctor, so they always want to see it, so that takes care of itself. But lab tests and some of the secondary things, I guess it's up to the care provider to tell them your insurance changed, but there's no easier way to do that, is it?
Unfortunately not. So the cards will obviously be different from Care First. Everyone will receive a new card. It's also something that will come up on the app that employees can have on their phone. They should be able to access their card there as well. I think it's always prudent for the employee, retiree, whoever is dependent, whoever's visiting the provider to just make sure that they're aware that they have new insurance and that it's through Care First. It really just eliminates a lot of headache for the employee. So to encourage, we're going to definitely encourage that they make sure that they do that when they go to their providers, whether it be the doctor's office or a lab or a hospital, because it goes to United Healthcare, it gets denied, the hospital's going to bill you, then you got to work through that. And so just head it off and give them your new card at the beginning, and hopefully that'll eliminate some of the issue.
And just from experience, I won't mention the person sitting in the front row, my mother, had that with Baltimore County last year. They changed after many, many years of being on the same. She had her card, everybody's got the card. She never got a card, supposedly, and they denied it. And the doctor's office called, said it's been denied, and she called them up. They said, you've been terminated. She's like, why have I been terminated? And it really is because they'd switched insurance and for whatever reason didn't have the new card. And you don't think about it. You've been doing it for so long. Here's my card. So make sure people know everywhere you go, you have to give them your new card. And hopefully this will be for a long term. But you think you don't think of it, and she thought she was terminated. And really, yes, they did terminate you, but you now had this, and it just either got stuck in the mailbox or
Yeah.
it disappeared the card.
Yeah,
So we need this,
definitely.
all of us have to be reminded, especially people that are used to using, elderly people that used to use the same card for a long time.
Yeah, we'll definitely make that part of our communications and keep sending those reminders. And after the first of the year, make sure individuals are aware just of that reminder. So, thank you very much. Appreciate it.
Thank you.
Thank you,
Have a
Rob.
good rest of the day.
Vote.
Wait, did they vote?
No,
did
no,
not
I didn't
vote.
vote.
Oh, well, see, I was done. Thanks a lot.
We didn't vote yet, but
you made
no
the
more
motion.
questions, no more
Second.
comments?
I'm sorry, you
All
asked
those
the
in
question.
favor?
Yes.
Aye. Opposed? Wait, I was gonna vote against it just to show you not to take us for granted. No, thank you very much.
Thank you.
Now, citizen services, we're going to talk about engaging neighborhoods, organizations, unions, governments, and households, local management board capacity, and the grant program and acceptance of the award of the grant.
Good morning to you both.
Morning.
Morning.
Good morning, Commissioners.
Morning.
And welcome, Commissioner Krebs. Great to
thank
see
you.
you with us this morning. Initiative. And I'm Celine Steckel, the Director of Citizen Services, and I'm here with my local management board manager, Ed Singer. We also have Debbie Standiford, our grants manager from Management and Budget with us as well. And I believe we have Scott Yard will be joining us. He is the vice chair of our local management board, and he'll be in the audience with us as well. Just from that perspective, he's also the CEO of Human Services Programs, Inc. The local management boards, as you know, have long been recognized as a local convener in our local communities, working with children, youth, and families. And they have been selected as the entity that will initiate and administer the Enough Act initiative. And so we are in our second round of funding for capacity building for the Enough Act initiative this year. And we have received the notice of funding available, and I'm going to turn it over to Ed, who will walk us through what that looks like and what we're planning to do with the funds we received and the targeted audience for that funding and that initiative.
Oh, and Celine, very briefly, just for anybody who may be watching who doesn't know, what is the Enough Act?
I'll let Ed.
Let Ed do it? All right, let Ed do it.
Speak to that, as he is the expert, and that's his spiel.
Commissioners, good morning. As you guys know, and for the audience's benefit, we've been out engaging communities in high poverty areas, especially focusing on an area in Westminster and out in Union Bridge. And we've worked with a lot of community partners over the last year. And what we're looking to do is we've got we've gotten community input. We've put together a plan, and we're going to be bringing that back to you guys in I think it's next week. Next week we'll be bringing that draft plan to you to share with you. But last year, at about this time, you allowed us to accept the award for the Enough Act funding to go out and focus on these high poverty areas. And we hired a coordinator, and we've been working on this plan since January, and you'll get to see that next week. But this year, the Enough funding's not as much as it was last year. But we've got a way, and this gets complicated because we were selected as a hub, which has nothing to do with the Enough Act. That has to do with the community supports through the Community Health Resources Commission. So some of the time that I normally work in our Governor Office for Children's grant, the CPA grant, is now over in the hub. So what we're looking to do is blend some of the funding from the Enough Act that the governor gave us was able to get this programs at YSB and whatnot, and the need to get out into other places other than Westminster. And Tawnytown and Union Bridge need support too. And so part of what we're required to do in some of our grants is to focus on those areas. So this is kind of the coordinating piece that helps us do the analysis. We're going to take the information we have. We're going to use the funding that we're given through other programs to try to fund programs that are going to support what the needs are that are identified in the community. And then we're also going to look for other opportunities, whether it's working with philanthropic partners or whoever else we can find to try to make sure that the people who need the resources most in our high poverty communities can get those resources. So, we're looking to continue the work that we're doing. We've kind of mapped out the way that we're planning to fund this. It's getting complicated in the LMB with the hub and the Enough Act and the CPA that we've always had. And funding's been difficult. Last year, the governor intended to give us the same amount of money that we got the year before that you all approved for us to accept. But the legislature had different priorities, and they didn't get it. Now, the Governor's Office for Children and the governor have said they're going to ask for that amount of money again this year, but we don't know what's going to happen in the legislature. So as this comes along, we're kind of in a similar place we were last year. Could I guarantee you that we're going to continue to get the same amount of funding in these programs? No. So there's always some risk that we will have to eliminate a position at some point in time if we don't continue to receive the state funding. But this is the plan we have, and this is what we're presenting to you. And we have, the way we've laid this out, we'd have enough to continue the Enough position and continue the momentum to work with these communities if you all approve it.
And if you look at the budget, we have the Enough funding is $56,739. The FY26 CCIF NOFA funding is $26,000. The 27 NOFA funding is $22,000. No required county match for a total budget of $105,520.
And I'm not sure if you remember this, but a number of years ago, I think you were involved with Access Carroll, and we were trying to be a federally qualified health center so we could get federal funding. A lot of money comes with that. And it was the same issue of the census tracts. We did not have any census tracts that were high poverty enough. However, you put a bunch of them together, and we certainly have a level of poverty. And Tammy Black, the brilliant woman that she is, we decided to bring out the feds, which is different, people from that decide these things, and to figure out, is there a way that we can look at, instead of just looking at census tracts, it might just not capture things in those tracts. We have the people, we have it in areas, but not necessarily in a tract and it's the same situation here. And we never, they came out, nobody really knew like who needed to do what. We started to get some of our federal folks involved, and then Tammy went in a different direction, and we never finished it. And it went on for like a year. But I don't know if there's a way to, using census tract data doesn't help us, yet we have numbers. We have a total in certain areas. Is there any way we could like get to the root of the problem and follow up on that so we could qualify? Like we were one of the only counties in the state that did not qualify for a federally qualified health center. And that would have definitely helped, Access Carroll. So I don't know if re-engaging that conversation, maybe Tammy would be able to remind you what all the work that we did. It was like at least a decade ago. But it really does stop us from getting these types of grants, and we have the population, they're just not in a certain census block enough. But collectively, it's there. And maybe we need to change the way they look at it or something, but we were the only county that was not qualified for that. And we certainly have our share of people in poverty.
And I work very closely with Tammy on that when we were looking at that. And I think what we've found is, what's really tough is if you're a person of limited means in a county that's very wealthy, statistically, it's hard to make that work. And even when we were looking with that at Tammy, there was just no way you could make those numbers work. And the state, with the enough funding and the enough grant funding, is setting the rules for that. The Governor Moore and his, and we're still not qualified for any of the competitive grants. But what we're looking to do is try to take the existing resources we have, like the CPA money that we use for programs to support families, youth, and children, and directing that to where it's most needed based on the information that we're gathering. There is a big. I think we have some very generous philanthropic community out here in the community. If we could take some of, maybe some, and we do this all the time. I think, you talked about Boys and Girls Club this morning. I think they do such a great job of taking, the county gives them some government blending and braiding of funding, and I think we've got to be creative out here as to how we make things work. And Access Carroll had always done that and has always done that to try to figure out how to meet the needs of the community. And I think there are a lot of things we're not going to qualify for, but does that mean we shouldn't do anything for our at-risk population? Absolutely not. We need to figure out how to do it with the resources that we have available. And frankly, we don't get as many resources, and I think the school system faces the same challenges. The places where they can demonstrate that there is more financial need seem to get more. So we have to make do with what we got, and I think what we're trying to do as a local management board, through going out and talking to people in the community and getting this feedback, and we'll share the information we have with you when we come next week. What we're going to do is we're going to try to concentrate those resources where they're most needed.
I understand everything you're saying, and I agree with you. But we are a wealthy county, but so is Howard, and so is Montgomery. So is a lot in Worcester. They're wealthier than we are, and all of them qualify for these things. It just happens to be the way they look at a census tract. It just happens to be where people live. It was an easy way to do it at some point in time. It's worth a conversation, at least at the state level, to say, hey, this is our situation, because they don't realize how it impacts the county. And again, back then, we were the only county that did not qualify. We're not the richest county. So somehow theirs just seems to be in the right census tract, so they can call a certain census tract, whatever. So my point is, sometimes bringing it to their attention. I mean, the feds is harder to change. The state is not. They just need to understand, and maybe they need to tweak something and look at maybe 3 or 4 census tracts together. They have the ability to do that. I'm just saying, open that conversation. We do have philanthropic people here. They're not wealthy, but we also pay our federal and state taxes, and we should be able to get a piece of the pie. Just because this little way that they do it doesn't help us, doesn't mean it can't be fixed. For not just for that, this is not a huge amount of money, but it has impacted us in other ways.
I absolutely agree, and one of our plans after we complete the needs assessment, do the presentation before all of you, would also be to then, as we take that back to the state, they'll be at the table with us when we're here next week presenting, but also to work with them on what our recommendations are from that needs assessment, and then as we're successful with how we would do implementation, to then have those conversations with them about how can we be in that competitive funding allocation, because we really, as you said, the philanthropic community, we've talked with them already. We do know some folks want to have those discussions once we make the recommendations. However, we do need potentially additional supports to help us to support the initiatives that we want to
And
embark
if you can
on.
think of a way that formularily it would work, recommend it. You know, if you can think, say, hey, what if we did 3 tracks, whatever, that way they have some solution maybe in front of them. Sometimes they don't know what we have sitting here, and you have to sort of open the eyes to that.
In census tracts, you know, one of the things we learned through looking at these communities in the Enough Act, I mean, the one census tract that we were given that here's where we want you to focus, it ran all the way out to, I get the names of them all wrong all the time, Friendship Valley Elementary School out by Kate Wagner Road, all the way down to Main Street. And we're like, well, that part of the census tract, that doesn't make it. So they did let us redraw that for our enough work to say this is the area. And frankly, it seems like every state grant right now is wanting some relationship to this, to these enough communities. So they did let us redraw it. We took things further up Pennsylvania Avenue and things of that nature, as opposed to just following the census tract line. So at least they're trying to let us make sense of things that way, where we don't have to specifically, you're drawn into this box and that's that.
Good, because census tracts don't make a lot of sense, but
Not when you're looking at it from a poverty standpoint.
right, thank you.
And Commissioner Krebs, this afternoon, we're meeting with our delegation. It might be something worth bringing up with them. I'll make a motion to approve the application of the LMB Capacity Building Grant under the Enough Program and acceptance of the award.
Second?
Have a motion, a second. Any further discussion or questions? All those in favor?
Aye.
Opposed? Thank
Thank
you.
you, Commissioners.
Thank you.
Thank you, Commissioners, and just, again, thank you for your support yesterday at the Expo and just always supporting that event.
Such an awesome job, as always.
It was a fun and very informational event for everybody. We've gotten great feedback, so we appreciate all of you and the support every year surrounding that.
And there's so many people there to talk to. It's hard to leave, you know?
It is hard to leave.
There's always somebody else to talk to.
And it's over before, it's over, and I think we just started, and yes, it's a great day.
And the
so-
amount of work that goes into preparing for this. I mean, I know you were saying yesterday, you had people there all day getting ready for this.
Sure, and just another plug too, the whole county participates in some way, shape, or form, whether it's the different departments that have tables there sharing information, but also our facility staff, public works staff, road staff. Everybody comes in to support the parking, to make sure that flow goes well, and then the event and the setup and the tear down. It's awesome. It's just a really great team building piece for the whole county as well. So I appreciate everybody that pulled in. So thank you.
Thank you.
Thank you.
Thank you. And now we're
What
gonna.
a picture that
There
is.
you go.
Disposing.
And law enforcement, I apologize, I was remiss in mentioning them.
Oh, yeah. I was being arrested.
Again?
Yes, again. Public Works is going to talk about term contract for a traffic engineer, and as he's walking up here, I just want to remind everybody, if you're here and you want to make public comment, please fill out a card in the back and give it to Roberta.
Morning, Doug. Morning, Corey.
Morning, Commissioners.
Morning.
The Office of Procurement, in cooperation with the Bureau of Engineering, requests your approval to utilize the term contract with Wallace Montgomery for a contractual traffic engineer in the amount not to exceed $68,640. Wallace Montgomery was previously awarded a term contract that was competitively bid. This amount is within the FY26 adopted budget.
So Commissioners, we have been here before. We are here today to seek your concurrence to continue the use of a term contract to provide an on-site consultant, traffic engineer for up to 2 days a week for a maximum of 6 months. Traffic engineer position became vacant in March of 2020, and since November of 2021, we've had a consultant on site assisting us, and this has worked well. While this is not our preference, we have not been successful in hiring anyone to fill this position to date. And in full disclosure, we have tried. I have to say that in partnership with our Department of Human Resources, our county administrator, we have made 2 attempts in recent months to bring people on board at what I would tell you was, while within the salary range, above what would be a normal starting position. I believe in one of these cases, the individual used us for a promotion at their own place of employment, and in the other case, I'm not quite sure why they declined. And again, all hope is not lost. We continue. I, in fact, have been recruiting myself, and I believe we'll have another interview coming up a little later this month. We'll do our best. But certainly this is a field that is in high demand these days and something we make good use of. So that's where we're at today. Glad to entertain any specific questions you have, but that's the information.
We get some emails, and many times I think people don't understand, but could you explain briefly what all the traffic engineer does?
Sure.
I mean, are they involved in bid proposals and
Got a
all
list
that?
for you.
And why is 2 days a week the good balance on us using a consultant?
So 2 days a week is not what we'd prefer. Again, but we try to be penny wise and not pound foolish. We know that this cost, when you look at it, associated with what we get for 2 days a week, is, big. Compared to, a lot of people would compare it to, well, you're paying that person that salary. But we have to remember, that's really overhead because we're paying a company under contract to provide this individual to us. Now, what do they do? Typically, site distance variances. This is developed in every part of the community. You'll hear this with State Department of Transportation. And typically, we would be able to turn those around in 2 weeks. And today, at only under 2 days, we're up to about 4 weeks, twice that. We get over 30 requests were received last year. We're well on our way to topping that this year. Special events. We have 4th of July. We just had yesterday the special events for the Seniors on the Go Expo. Everything involved in that had a traffic plan. That traffic plan was created by that traffic engineer. When we do 4th of July, created by the traffic engineer. Why? Well, we want to make sure we can keep the hospital open for emergency access. We've got to increase routes. Where do signs go? Where do people go? You've never heard from our customers a complaint on the 4th of July, and a large in part because we have a plan. We don't just go into it, and that's our goal. We don't want you, we'd love you to hear compliments, but we don't want you hearing complaints. So special events, we do about 20 a year. Signing upgrades due to road hardening. Every time we change a road, pave a road, do anything to a road, we have to do. We do a minimum of 4 currently going on. We get multiple requests for signs and markings. I got 2 just yesterday asking us about stop sign. All that involved traffic counts, data analytics, and the traffic engineer. Multiple traffic calming projects currently ongoing. New ones come in every month. And then we're also reviewing for traffic barrier, right, guardrail, everything that is involved in that. And then any other new development that goes on within the county. So it is a critical position. All of our times on our turnaround have increased. When I tell people today that we'll look at your request, and in fact I've had that, well, that means it's going on the list because that list is revolving. And then if you all tell me this has become priority, that changes that list. I put that one up in the front and everything else goes back one.
And we feel like, you feel like currently we don't have anybody that could fill this position that has the expertise, but do we have staff that helps this person pre-planning stuff or whatever?
Certainly. So our division manager, Chris Lanachin, he obviously, this all was created by retirement many years ago. Chris was then promoted. The position was vacant. It was filled for a short time. We do things every day amongst us. So when I said traffic counts, our Division of Roads Operations, those personnel go out and set out the traffic counts, but the engineer provides the expertise on, okay, I need to study this, and this. I need it for this many days, and then you bring back the data. It's the same thing that we do just like the signs or the post. That individual does it, and then we sign it out. So it is a cooperative effort. We don't, to answer your question, have anybody else in-house right now that is qualified to do this position. And again, this is something that we struggle with every day, and hopefully, again, I would love to get this person in and on board. And I can tell you, we work with the agencies. If I get someone out there who's a good candidate who wants to come to work for us, I'm going to do my best to get them in the door, whatever that takes. And I would say that we've had the cooperation of Director Bixler sitting behind me here. On the last two candidates, they just didn't pan out for us. And I think we made very good offers.
And then lastly, when it's county, and I'm trying to understand that I'm now government, does the traffic engineer, do they do their engineer stamp on their plans, or is that where we are liability by using a consultant to do this?
So our consultant is a traffic engineer, has a stamp, but our division manager also has a stamp. So we can cover that either way if we need to. But for different things and developments as they come in, it's part of the development process that the engineer that relates those to us has to sign, seal, and stamp it.
Okay. We have.
I got just a couple questions. How long has this job been open?
So this job originally opened up through that retirement that I spoke about, Commissioner, in March of 2020. Originally then in February of 21, we were successful in filling it with a person who had retired actually from MDOT SHA. But after 3.5 months, they took a position with another one of their retired partners in a different county who actually recruited them away for us for more money. And we couldn't meet that in the benefits. Since then, it has been vacant, and we've been using the consultant.
So how much did we pay the consultant last year on the contract?
Sure. So last year in the contract, actually it was 3 of 25. Our last contract was $52,000, 2 days a week, 6 months.
But you mentioned earlier that it was up to whatever the need was. So do they do 2 days a week they bill 2 days a week?
We generally try to keep them 2 days a week. Sometimes under our contract, if the business, their engineering firm needs them in another place, they will call us and try to fight us or pull them back to take. When I say fight us, it's we try to make it amicable. They say, okay, you can't have them Tuesday. We're like, okay, can we have them Wednesday? We got heavy workload to get them in
So
here.
did we spend our contract last year?
We did.
We topped it out? So we're
Yeah.
expecting to fulfill it this year?
Yes, ma'am.
I guess, you mentioned a lot of the needs. I never knew what they really did. And I understand all these special events. It seems like a lot of need. I'll tell you, in my area, the need is level of service on our roads. And we're in the Freedom District, and that's the biggest complaint we have, is that we have not successfully maintained and kept up our roads with the growth that has occurred. And the level of service, and it's many, many places. And it sounds like this person would be able to help us out, whether it's movements and intersections. Now, a lot of it is sometimes state highway, and I
Right. We
called
work
state
with them,
highway
though.
many, many times on their part of it. But some of it is new development and how it's going to affect the level of service.
Yep.
And I think that is sort of our responsibility first, and then, state highway, we recommend it. So how does that work? Because where we have 2 big roads, 32 and 26, that are state highway.
Mm-hmm.
However, I'm not sure who's responsible for making sure that level of service for any new development will be sufficient. So whose responsibility is that?
So it comes through, so first thing is it comes into our Department of Planning and Land Management. I know I got that wrong, but somewhere close around there. Sorry, change title messed me up. And then once that comes in, their reviewer works heavily with our traffic engineer and our engineering department. And then all the things that were required as part of a development. So let's say you're a developer, you're coming in, you're going to do this, and it's going to enter on a county road. We require that you do a traffic impact study. And that traffic impact study would be laid out based on the number of units and the number of traffic that you're creating. And that would be the same whether residential or commercial.
But there is a limit. You said traffic impact studies, but as you know, it's only if it's over a certain number of trips.
That's correct.
So if it's so many number of trips and you have 10 of those, 10 of those that don't require it add up to 10 times that amount. So how do you then accumulate that? That's sort of what we have, is that many of these projects never need a traffic impact study. But there's a bunch of them. And then they add up and there's a problem and we've never had a study. So how do you look at the accumulation of all these smaller ones that never get a study and make sure that the study, I don't know who comes up with, hey, it's going to be 40 trips. I know in the retirement communities, they say they're going to have less trips.
And they have more trips.
Oh, sure. When you're retired, you don't go to work once a day. You're in and out and in and out. So
Wherever you want to
I
be.
question when I see some of these numbers about 40 trips, I'm like, do they just sit home all day? So how do we make sure that what's being presented to us is accurate, that it doesn't need a study, because we don't have studies on all these things, and yet it's a problem.
Yeah. So I would tell you that and I don't know if I have the exact answer. As far as the studies go, it comes out of national standards. So the national standards are what everything that traffic does is based on. And they would tell you that, and that's where it comes from. If it's a retirement community, the national standard says there are this many trips per day. If it's a residential community, if it's a certain type of a business, a doctor's office, it's this many trips per day. So it's not just a wild guess. They do update those manuals, and it is the national standard. Once that gets in, then our folks look at it and they bring in the realism, right? So you could say, okay, if it's going to involve 140 or 26 or 32, we know we're already having problems and we don't want to do that there. We're going to push for more mitigation, or we want you to escalate that count. And what it gives us is then a grading on the intersection, right? Everything from a good intersection that's flowing good or a good crossing to one that is failing or one that's in danger of failing, and then we push for that. We don't always get what we want because it is, oftentimes part of a negotiation. And then ultimately, it can go before our boards that we have here in the county, and they can change what we may desire to be the case. That is a fact of life with what we deal with. But that's the best that I can give you, that we do work. And certainly, yes, the more things that we would have the traffic engineer for, if we had them 5 days a week, the more that would reach out. There are examples that we get every day. Our citizens will call us, our customers, as I say, and they'll say, how come your traffic data on your website's not current today? Because the traffic engineer does that, and right now that's fallen off the plate to keep the website updated, because we're out doing traffic counts, we're out doing traffic studies, we're reviewing engineering plans for new developments, and we just don't have the time in 2 days a week.
Now, piggybacking her question, we can't make the state do one. We can ask the state, like the Ethiopian church on Bachman Valley Road. The state says it's not necessary. We can't make them.
Correct.
But if you had a subdivision going in on an Ibvale, do they consider the state traffic also?
We consider everyone's traffic, yes.
Okay.
Yeah, we do have, while the word make, you're absolutely right, we can't make them do anything. And particularly with District 7, we have an excellent working relationship with District 7 and with the local Westminster shop, that we work very well together. And if we have a concern, they try to mitigate it and address it. Most recently has been where we all met because some concerns had arisen over the potential closure in the bridge on Route 26 as it goes into Baltimore County. It was an excellent meeting with the state. We now have a regular communication line open, and we are working every day to develop a plan that'll get the bridges work completed, but will also make our customers happy and not deal with other things down that area.
That'll be interesting.
We're working on it.
That if that doesn't turn out ugly, we'll be very lucky.
And I want to just get back,
Yes.
you mentioned a lot of things that they do that are extra, like the parades and all that, and that's fine. It's the everyday stuff that I'm seeing in my area that's not getting looked at, and maybe they don't have time to do it, but I'm looking at this salary, and if you do the math, the equivalent for this 6-month contract, 2 days a week, is almost $350,000. That seems like a pretty good salary to me. What is it, what's the range that we're asking for this traffic engineer? Obviously, it's supply and demand, and if you can't find someone in 5 years or 3 years, it seems like maybe we're not doing something right.
Yeah.
So how do we get to reality and say, how do we get a person on site that is focused on just us and our priorities, and make sure that we can take care of the needs of all the projects that are happening that are going to affect us for years, not just the one-time things?
Yes,
And it needs to be a priority.
I agree with you. So currently, to answer your question, in the FY26, it is an A500 within the county. It has a salary range of $80,247 to $144,415 at 40 hours per week, and typically it is salary commensurate with experience. Now, as I said a little bit earlier, I can't recall the specific number detail, but I will tell you it was at the high end of this range that I just read to you, and we went after two folks. what I feel would have been excellent offers that would have also maintained consistency within the county. You see that we have a lot of long-term employees here that I also have to be cognizant of when I bring someone else in new off the street as to what they're getting paid and what this person's getting paid commensurate with training and experience, and we do that. I think those were reasonable offers. The unfortunate part is I just couldn't get them. So we absolutely don't go out and lowball it and say, okay, you're coming in and I'm only going to pay you $80,000. I can't even get somebody to come in and interview for that much money, right? A traffic engineer won't come in and sit down at the table.
We're paying the equivalent of $343,000 for a 2-day-a-week, the equivalent, if they were full-time. So I guess my question is, somehow we need, it sounds like the demand is there for this position, at least considering what's not being able to get done. How do we, first of all, this is another 6-month contract. How do we show how important it is to get this position filled? And, you mentioned about other employees, and I get that. In the real world, it's supply and demand. I know people in my job made more than me when I worked. It's just, sometimes that's just the way it goes.
Yeah.
So how do we get this competitive so that we can and get the word out there so we can get a full-time person? It's been 5 years since the last, since the person left. And not keep paying. I think we're paying a lot, and we don't necessarily, we're not top on their list of priorities.
So again, I mentioned earlier, let me be more specific, we have an interview on the 22nd of this month.
So should we put this off and wait till the interview?
We can't. We will be out of a traffic engineer and so far backed up that we can't do
So
it.
can we do a month-to-month contract?
Not with them without probably renegotiating what their terms are, and then it may get more expensive. In the dollar figure that you mentioned, we also have to understand that that's not the salary that's just going to the individual. While it is the contract, we are paying overhead to the engineering company who builds this out on a regular basis.
And supervision and payroll and
Everything that they
vehicle
do,
and-
all the overhead, the other benefits that come in with that employee, health insurance, everything that's paid separately is coming in as part of that fee. We have negotiated that hard and strong. We've absolutely done our best to keep it as reasonable as it is. But no, we need this position while I continue to do that. We don't want the hole that we're in to get bigger. It already has increased, right? What normally would have taken us, as I said, 2 weeks to turn around our job that is part of our job is now taking us 4. And these are our customers within the county. These are people who are county residents that might want to add a driveway, that might want to do something on their property that we just can't get to right now in the normal fashion we
You just made my argument, is that we need to find a way to get the person on staff 5 days a week.
Oh, yes, ma'am. I agree.
So in the budget, you mentioned it's already budgeted. How much was budgeted? Was it budgeted for the full-time position of something competitive, or was it budgeted again to continue the 2-day-a-week for the 6 months contract?
So I can't speak, and I don't know to exactly how management and budget works with it. What I can tell you is that they know right now what our contract exists for, and it also is in there to satisfy the money within the budget for a full-time position within that range.
Within this range, but this range, obviously, from what you're saying, and Christie can answer, we're not attracting candidates in this range. So what do we need to do to attract a candidate that it's going to be less than what we're paying with our benefits, and we're going to get a full-time person? So that's my question. And this isn't like, it hasn't happened like for months, this has been years.
Right, understood. So we just recently went through a reclassification renewal. We went through the whole process, looked at all of our job descriptions, reclassified all of them. And I believe this position was one of the 400 and some that did get an increase in classification. So it is a higher level than what it was previously, so we're hopeful that that's going to help us with recruiting. We've also taken some initiatives recently based on some new staff in my office, filling vacancies that we're trying to promote it more than what we had been able to do previously based on social media and getting out into the schools and the colleges and things like that. So we're taking some different initiatives to try to promote it a little more differently than what we had tried before to see if we can bring someone in. As Mr. Brown said, the base salary is $80,000. It is in a range. Our pay scale has, I believe it's 9 different classifications for the exempt positions, and their ranges go all over the board. So it is a range. We do offer, we've put that position in the range due to its responsibilities, level of responsibility compared to other positions throughout the county. So I think it's situated in the proper range. I think we just need to be able to draw someone who sees the value of the benefits that we're going to offer in addition to the salary, which has been a challenge in some instances, but the offers that we make are not at the minimum for this position.
What is the benefit burden that you put on the salary?
I believe it's somewhere close to 50%.
All right, so right now, even at the top end of this, at 144 at 50%, you had another, you know, 75,000, so it's still less than what we're paying a person equivalent for 2 days a week. And I'm just saying from my point of view, we're not getting the services that our county needs urgently to do, and we need to somehow accelerate that. And if we need to even make this higher, I don't know how much we're getting out there. It seems like a good salary with the benefits. But I also don't think it should depend on who else is here. If somebody has a level here that we need and we got to fill the spot, then we need to fill the spot.
Right.
And that's, I mean, I don't know if that's how we do it in government, but that's how we have a need there. And I see a huge need in our area that things are not being looked at. Not the parades and not the special events, but the actual everyday functioning of government, of looking at these road connections. It's not happening. It's not happening when plans get approved. It's not happening when developments are getting built. And you can see it. So I guess what I'm trying to find out, how do we accelerate this? And if you will hire somebody and we do this 6-month contract, do we have the ability to stop using them?
Yes,
You do. So there's something in there to say there's no minimum buyout.
yes, we can stop it.
And what is the end date on this contract that we have now?
It comes up on, I believe it's the 16th?
Yeah.
16th
yeah.
of this month.
16th is when this 6-month renewal will start.
And so there's no month-to-month on that. So,
Correct.
and again, I'm going to just say, it sounds like we're second fiddle to this company. I thought it was a person that was retired or something. Sounds like we're not like first in line for what we need. I really think we should get this a person hired, and we got to figure out if this range isn't good enough. I mean, it seems like a good range to me with benefits, but it's an important position. And it's been years. I mean, it's 5 years since we've had a permanent person. I know we tried and the person left. I don't know if we could have kept them. I don't know what they're paying in other counties, but this is a really important position. So I would like to try to encourage, if we get consensus, to get this position filled and not wait. I don't want to come back next year. I read the email that was sent to us, but I don't know if Kathy wants to talk, but when I look back at how many times that they've come to the board every year and say, we need a position, and every year it keeps going up, the amount of increase on this position that we're paying, and it's not getting filled. So I just want, from my point of view, it's a really important thing, and I don't know if we can get consensus on how do we want to move forward today, because we got this in front of us for 6 months, and then we've got, somebody being interviewed, but we've got to get this position filled.
Our decision today is this. I've paid consultants, so this isn't a bad deal.
But it's a worse deal than if we could pay somebody this amount of money and have a person in staff 5 days a week.
Yeah, I don't agree with that, but that's irrelevant, but,
You couldn't get for $350,000, you couldn't get somebody to work here for 5 days a week. I mean, right now, we're offering 80 to 144. We're not even close to what we're paying. So if, by hour, I'm looking hourly, daily. If you break it down, we're paying way more than and we're getting way less. So maybe we need to up what we're paying, which would still be less than what we're paying here. If you do the math, I'm a sort of a fiscal hawk, and I'm a fiscal, I do the numbers. So we need the position. We're paying more for what we don't want doing it this way. And however we need to do it, we're still going to come out ahead. And if we can't get somebody for $343,000, that's pretty good. Maybe I'll go be a traffic engineer. I got to go back to school. But anyway, I think somebody wanted to speak.
Well, my thought about this is that, we obviously are in need of this particular position. My suggestion would be to move forward with what's in front of us, and then it would give us a 6-month window to determine how to proceed to figure out a long-term solution.
Well, and I'm just going to mention, if you look at this, we've had this Kathy has been writing in. I've just got all the stuff from the last 3 years, and I'm not sure what the board's deliberations were back then, but this is now the 3rd year of the same exact conversation. And I don't know who you've been having it with, but Kathy may want to speak. So, putting it off for another 6 months is not, again, it's a sense of urgency today. We waited 3 years. 3 years, Kathy's been writing in and saying, what are you going to do about that? And we upped the amount, I forget the percentage. It's a very large increase over the last contract. So anyway, I don't know if Kathy wants to speak?
Well,
We're going to do that.
Go ahead.
Before a motion, Commissioners, any other discussion?
So it sounds like we're all advocating for the same thing. We need a full-time traffic engineer. HR's track record with hiring people that are historically difficult to hire is very good. I've seen what you did with the Department of Fire and EMS. A lot of people didn't think it could happen, and it did. So clearly there's a renewed interest on the board, a renewed sense of urgency. If we have to provide more salary to the right person, then it sounds as though we really are advocating for that as well, and I don't know what that's going to involve in terms of motions, but yeah, unfortunately, we'll have to go do this today, and maybe we can take a renewed approach and get who we need.
And I think if we want them to bring us back something on how this position will be hired, do a work session, do whatever, we can certainly do that.
Sure.
That's not part of this agenda item. We have some public comment for this.
I was just going to say real quick, and part of my consideration for why we might wait the 6 months, as Christie noted, we just went through the reclassification, and so that'll certainly be a help going forward to determine how we can better enhance what we're offering for the position.
Well, just from I guess, a question for Chrissy. So if we have a need that we can't fill, you just said we reclassified 400 people. Do we have a way to, look at one isolated position at a time? This could happen in another position. Do we have to wait for reclassification of 400 people?
No,
So
this
we
was
do
just
we
an
have you
overall
have the
project.
ability to look at one at a time?
Of course, yes,
'Cause
we
that
can
would- we have
definitely
to be
look
flexible,
at.
you know.
Yeah, we'll go back and take a look at this position. Like I said, we just went through all the positions and set up a new classification system. There's different, the structure is very different from what it was before. We can go back and take a look at this. There's I believe a 9% difference between one classification. So this is A600 to the A700. So the base rates are only 9% different, which means that the maximum rates, because the ranges are the same percentage, are only 9% different. So it's really not, I'm not going to be able to jump it up to a point where the minimum's going to be $140,000. That's, the ranges are what they are, and that's why we have ranges, so that we can hire in between the minimum and the maximum, depending on where the individual needs to be for that particular
Well,
position.
and if you have a range, we make the range, if you can't get somebody in a range and you've actively recruited, then the range isn't correct. So, we can't just leave things open. I just want one more question. The towns, how do the towns, we don't do this work on behalf of the towns. I'm looking at Kevin sitting there thinking, how does Westminster do it? Do they have their own personal staff, or do they hire out? They might not have as much need, but how do they operate?
Some will contract out, and typically that's what we find. I don't know that they keep on a full-time traffic engineer. Again, I have never asked that question of them, but I will tell you the times I've been involved with them in development review, it has been information provided by contract sources.
So we don't do it
We do not.
Okay.
We do a lot of other services for the towns.
No, I just didn't know if this was part of
This
it.
is not one of them.
We have public comment, correct?
Kathy Martin.
Good morning.
Morning.
My name is Kathy Martin. I live at 6405 Locust Lane down in Sykesville, District 5. Great to see you, Susan. Congratulations. I'm going to add to the conversation and not reiterate what you've already heard. The salary is at the A500 level, not A600, if that makes a difference. As I mentioned, one of the comments in the job posting is a comment that says expected initial salary, 80 to 84,000. I think as a marketing angle, that might be a little bit of a negative comment to make, when in fact it sounds like Mr. Brown, is offering more of a competitive rate. So I would just give feedback to HR on that. I noticed that cropped up about a year or so ago, this comment called expected initial salary. So I think that might be a little bit of a negative in this particular case, especially. Susan, the percentage increase in this year's contract is a 23% increase, from 52,000 for 6 months to 68,648. So that is a very large increase, 23%. That has not been mentioned. I did do a little bit of data crunching, looking at the other salaries. So the Maryland average for a traffic engineer range is 85 to 94,000 a year. So that expected initial salary statement might be a little bit off-putting to someone who's expecting more of like 85 to 94. thousand in the state of Maryland. Thank you for reviewing the job description. The one area I want to add, Mr. Brown and I talked about this in the hallway, is the traffic volume data that is currently on the website for many of the large intersections in South Carroll dates from 2014.
Yep.
And so we're talking about data that is more than 10 years old, not 5 years old. So this is more than 10 years old, and this is very concerning. I researched the 2 intersections where we had fatal vehicular accidents in the last few months. We had 2 fatal vehicular accidents in 5 weeks down in District 5. So that kind of prompted me to say, wow, what is the traffic volume data look like for these 2 intersections where I live and travel like every day? The data was from 2014, so not 5 years old, right? 11 years old. So that is an ongoing problem. This is not something that's happened in the last 5 years. It's an ongoing issue. So I just wanted to point out those additional points that had not been brought up this morning. And I did look at the job description, and data analysis, trending, and correlation is part of the job. It is should be a prospective look at trouble spots, not a retroactive look after someone has died. So I'm just really encouraging you to think outside the box, do something differently about this position. It's so important. And I do have one other topic, but I'll wait until this one is done. Thank you so much.
Thank you for your comments.
Thank you.
Can I just add one thing? I just wanted to comment on the language you had mentioned about the typical salary. That is due to, you may remember, I think it was October 1st of 2024, so about a year ago, the state put in requirements for us on our postings that we do have to include specific items like the entire range as opposed to maybe just a minimum start rate. There were some regulations that the state put in place, and while maybe not the case in this position, certainly we can take that off of this position posting, and we'll go back and take that under consideration. But a lot of our other positions, when individuals see the range for an entry-level position, they're coming in. We were getting a lot of applications where individuals were requesting a very high salary for entry-level positions. So we put that language on there to try to make them aware that normal hiring procedure is that someone coming in at the minimum qualifications for the position is somebody that's going to probably start within that first 5% of the range, as opposed to making the maximum of the range coming in the door. So that's why that language is on there, but definitely something that I'll take back this afternoon yet and take a look at and see if that's something that we can remove from this one, looking at the range a little bit differently.
And keep in mind, given the fact that we don't have a department of traffic engineers, I would hope that we would not be bringing someone in that does not have experience. If they're going to a big firm, that's where they get experience. We need someone here that is experienced, because they're going to be the department. They're going to be doing the work. So just considering our situation, I would certainly not want somebody just out of college.
No, there's experience requirements on the position description. I believe it's 3 years. And thank you for the correction on the classification. They all run together. So.
And thank you. And thank you for bringing attention to it, Kathy. I mean, this is level of detail that we are not able to get. And as you said, and I know you would like to have somebody probably full-time that is up to speed. And I think it's long overdue, and I hate to keep pushing this, but this has been going on for 5 years, but 3 years that we keep renewing the contract and haven't really changed any of this stuff. And I think we need to give direction to staff about how urgently we need this. I can just tell you from my point of view, where my district, we are failing, as you said, the traffic data. We've built all this new stuff. We have hundreds of new projects ready to be approved, and none of this is even being looked at. So it's an urgency to me that we need to get this person on board and get them working and get some of this stuff updated. And we should never go and have 11-year-old traffic data on our website.
Agreed, and you guys are making a case why we should make this 3 days a week, probably. But
So are we giving direction that we want to go 3 days a week, or are we giving direction to staff that we want to get the person hired here 5 days a week?
they're not going to hire somebody next week. We need somebody now, so we need this now, and we can terminate it if we hire somebody. So it's a Band-Aid.
Okay. So how about if we whoever's going to make the motion, make a motion, if they want to approve this, to have you come back in a month and see how we're doing, and then, and not, you know, until we get someone hired, so we get updated on it.
I think we've been assured that.
Yeah.
we're
That
gonna
seems
do
reasonable.
Well, I'll make a motion to authorize the Bureau of Engineering to use the term contract with Wallace Montgomery for a contractual traffic engineer in the amount not to exceed $68,640 with monthly updates.
Second.
Any more discussion or questions? All those in favor?
Aye.
Opposed?
It's like, me on the record as opposed. Thank you.
4-1.
Thank you, Commissioner.
Thank you.
Thank you.
Now, general public comment.
I have Catherine Adelaide.
Good morning, Commissioners.
Morning.
As you know, my name is Catherine Adelaide, a member of the Carroll County Republican Central Committee. I am accompanied today by Sugar, is a medical alert and assistance service animal. It's his first time here. He had a very nice nap while it's not time to go yet. Anyway, it's his first time here, and many of you have seen him at other events and stuff, but I just needed him here with me today, so I appreciate that. It's a great alternative. These animals are a great alternative, both prescription drugs and illegal drugs, including pot. So people need to look at that a little bit more. Despite 9/11 and the assassination of Charlie Kirk, I am giving thanks to be able to attend the Carroll County 9/11 event this morning. And I wanted to read 1 Thessalonians 5:18. Give thanks in all things, for this is God's will for you in Jesus Christ. Christians are not required to give thanks for all things, tragic circumstances, but we are required to give thanks in all things. And so, again, I'm giving thanks that I could attend the event, but my big thanks today is for being here and welcoming the newest commissioner, Susan Krebs. You made it. Congratulations. I'm happy to see you here, and that the Carroll County Republican Central Committee had a great honor to fulfill our statutory duty to fill this seat. A name was given, and a name, the governor approved that name, and it says shall. So the job was done, and kudos to Governor Moore. You have survived so much in Annapolis. You will be great. You have already hit the ground running. I also want to mention the assassination of Charlie Kirk. And I want to read Matthew 10:32 through 33. This is Jesus speaking. So everyone who acknowledges me before men, I also will acknowledge before my Father who is in heaven. I wear this hat today in remembrance and honor of Charlie Kirk's life. Jesus was his savior. It says, Jesus is my savior, Trump is my president, and Trump was his president. I personally felt the Charlie Kirk effect in Carroll County before the election and after the election. Whenever I wore this hat or my Trump 24 hat, young men everywhere I went, mostly in Walmart, would run up to me and give me a high five. And that was the Charlie Kirk effect. In addition to rallying youth, Charlie was pro-life, called abortion murder, and believed it should be made illegal. There is a connection between violence in the womb and violence outside of the womb. This September 13th is the National Day of Remembrance for Aborted Children. It's St. Peter's Roman Catholic Church in Union Bridge, and I will post this information. So if I could just have one extra 30 seconds here. The Carroll County Central Committee will fill our vacancy with interviews on September 16th, and our next meeting will be September 25th. But I did finally want to end on a really positive note. I attended the Aging Your Way yesterday. It was absolutely fantastic. The health screenings, the vendors, showing us the Carroll County government services so people know what's out there, the lunch, the dancing demonstrations, but mainly the genuine care and concern. When you see that from government, that is the best government. They're not just doing their job. These people really cared about us, and I just say, well done, Carroll County government. Thank you, and God bless you.
Thank you.
God bless you.
And then Kathy Martin.
Kathy Martin. So I too attended the Aging Your Way conference yesterday, mostly with my friend in mind that I emailed you about 5 months ago, a gentleman who had a brain injury who is now living at home, 90% disabled, with the care of his 69-year-old wife. So two things were at the forefront of my mind yesterday. One was transportation services for a wheelchair-bound resident of Carroll County, lifelong resident of Carroll County. Carroll Transit was not at the Aging Your Way conference yesterday. I checked as I arrived. I went to every single table. I asked Celine, where is the Carroll Transit table? And she said they were not attending. So number one, getting the word out about Carroll Transit is really important. And so looking back with my friend in mind, I'm very emotional about my friend. I'm sorry. The Eldersburg line was eliminated in the fall of 2022 using COVID data to support their rationale for reducing that line and eliminating that regular route. And that has directly affected my friend. She is paying about $180 each time she has to take her wheelchair-bound doctor to Chesapeake Urology in Westminster because the Carroll Direct Response is not able to guarantee that they can pick her up within an hour of her appointment being over. Her husband has a brain injury. He does not tolerate sitting in his wheelchair for more than an hour in a doctor's office. It happened the other day. She was using a private service that she paid $186 for that one trip. He became extremely agitated, and he verbally, basically accosted the driver verbally. And Debbie was very embarrassed, and she really needs this support from the county, transportation, basic transportation. So the other topic that I was advocating for her was housing insecurity and caregiver support. They earn just above the limits to get caregiver support. And I mean just above the limit, a few $100s a month. And she doesn't qualify. So she's paying $1,200 out of pocket monthly right now to get 10 hours a week of help. He does not get out of bed without help. She is 69 and weighs about 115 pounds. She cannot move her 200-pound husband by herself. So she does not qualify for any support in this county except a $500 annual caregiver support grant, which she forgot and hasn't applied for, and I got her the paperwork, and she will apply. $500, you know, she pays $1,200 a month right now. And then housing insecurity. I asked the housing office. There were 2 booths that had the word housing in it, so I kind of went to both of them. And I talked with a gentleman named Patrick, and his job is all about housing insecurity. And I said, you know, my friend is probably going to have to move at some point. And what support do we have for low-ish, kind of medium to low? Like she's not very low income, but you know what I mean? Like that gray area of people. What kind of support do we have to help her move? And we do not have support to help her move. And I do not know how she's going to pay to move a household, right? We have very modest homes on Locust Lane. Just drive down Locust Lane, you can kind of see we have very modest homes. But she cannot move herself. So we do not have support for helping the elderly and disabled to move into a more suitable home. So I just wanted to share that with you. It's a little bit of an update about her and their situation. She is a very faithful person. And the other day, she was feeling very down. She's been doing this for 9 months now. His accident was in December. And I suggested that they start their day by praying together. And maybe that would help him to calm down and her to calm down, and maybe end their day by praying together and giving thanks for their day together. So anyway, I just wanted to share an update with you and talk a little bit about the expo yesterday and my disappointment with Carroll Transit not even being there.
Thank you.
Have a great day.
You too. Thank you.
And Kathy, while you're here, I don't know if Celine is in the building, but you might want to sit down with her and share some of these, because she's Celine with Department of Aging.
I'm sorry,
They
say,
are
I
aware.
I couldn't hear you.
I'm sorry. I thought maybe you might want to talk to Celine while you're in the building, if she's still here.
I talked to her yesterday,
okay,
and
good.
they're very aware of his situation, which I shared with my friend, because it was very comforting to her to know that they are at the forefront of their mind. And that I was a little worried about, like, anonymity and privacy, obviously. But I shared with Debbie that I was, working with Celine to advocate for her, and that Celine said, he and you are at the forefront of our mind. So that's very comforting to her.
Thank you for putting a human face on the services that we have and that we may need to tweak. Thank you.
Admin session open. Does any commissioners have anything they want to discuss?
No, sir, not for me.
No.
Agenda review.
Good afternoon.
Good afternoon, Wanda. How are you?
Good, how are you?
Doing well, thank you.
Is there paper for that?
Okay, Monday, September 15th, no activities. On Tuesday, September 16th, Planning and Zoning, Commissioner Gordon. At 2 p.m., Veterans Advisory, Commissioner Gordon and Kyler. On Wednesday, Historical Society, Commissioner Gordon. Community College Board of Trustees, Commissioner Kyler. ESAC meeting, Commissioner Guerin. On Thursday, closed admin, open session, priority Carol, local management, community needs assessment, update of Carol Voices, approval to submit application for a grant and accept the award for cardiac device, approval of fiscal year 26 Town County agreement with Union Bridge, Shot Creek Linings in Tawnytown, Shot Creek Linings in Eldersburg, storm drain replacement system in Eldersburg, a 2026 Chevrolet Equinox, 3 Ford trucks, 9 Ford Explorers, 4 Ford 450 trucks, replacement relocation at the airport for automated weather observation systems, approval to pay the City of Westminster invoice for the Office of State's Attorney construction project, admin open, public comment, agenda review, 4 p.m., Chamber of Commerce, the ARC 70th anniversary, Commissioners Kyler, Krebs, and Vigliotti. Friday shows no activities. Saturday shows Daughters of American Revolution, Commissioner Vigliotti, and Commissioner Krebs has the podcast.
And you know what? I saw that you said, let's give it to her, make her do this.
Oh, you,
Well, if you,
Well-
you don't need to. We always assign it to Commissioner Vigliotti.
Yes, he's the go-to.
He volunteered or was
he substitutes
voluntold
for
as
all of
everyone's
us.
backup, I think.
I do my best to support everybody.
I think I heard you at the last meeting say, well, let's just give it to Krebs, she'll do it. I'll see if I can get, I don't know how to do it, but.
Wanda, if you could,
and
could
there's
you
no
add me to
pressure, so
the
if you
ARC
can't say-
event on that Thursday? Thank you.
The following week, Monday, September 22nd, no activities. On Tuesday, groundbreaking ceremony at Shepherd's Staff, Commissioner Gordon. On Wednesday, Carroll County Realtors Annual Dinner, Commissioner Gordon. Carroll County Public Library Board of Trustees at North Carroll Library. And I cannot make that because I'm at Tolls. Recreation Parks Advisory Meeting, the Reagan Room. On Thursday, Board of County Commissioners closed admin, open session. Friday, Carol, Bobby's retirement. On introduction of the Deputy Health Officer, and it will be here to be introduced to us, public comment, admin open, agenda review, joint meeting with Board of Ed at 1:30, and all commissioners are there. Carroll County Arts Center annual member show reception, Commissioner Gordon. On Friday, grand opening of a bistro and bakery in Hampstead, Commissioner Kyler. And on Saturday, Tony Town Harvest Fest, Commissioner Vigliotti and Commissioner Kyler gets the podcast. And you can do 2 in a row if you want, and I can back. No. Any changes or updates on that? Need a motion for us to go into closed for land acquisition and then adjourn.
So moved.
Second.
I have a motion, a second. All those in favor?
Aye.
Opposed? Thank you.